In previous slide, we have discussed about candidiasis and the causal organism of the candidiasis, and there are different types of what are the types of candidiasis and their symptoms. Now we'll study how to diagnose the candidiasis. Now first we move on. Laboratory diagnosis. The first step of laboratory diagnosis is you have to collect the specimen. Specimen, basically the causal organism, its collection depends on the site of infection. Various specimens that can be collected include mucosal scraping, skin and nail scraping, urine from blood sample, cerebrospinal fluid, and sputum. Then next come microscopy, microscopical examination, or we can say direct examination. In direct examination, we just use simple compound microscope. In microscopic study, we see that we can demonstrate candida as a gram-positive yeast-like budding cells that can be with or without pseudo-hyphae, and it can be, in microscopy we use KOH mounts which shows yeast-like cells. This solution dissolves the other cells, but leave candida cells as such. Calcofluor white stain is also useful in demonstration of candida in specimens. Now next come culture. If we culture the specimen, what should be the media we can use, and how the culture growth appears. It grows readily on bacteriological medium as well as an SDA, that is subodextrose agar medium at 37 degrees Celsius, that is room temperature, after overnight incubation. As morphologically, colonies appear white, creamy, and bacteria-like. You can see here, this is SDA agar media. These colonies are white, creamy, and bacteria-like. If we talk about how its gram staining it appear as gram-positive oval budding yeast cells. You can see here, gram-positive, that is purple in color, oval shaped and budding structure. A positive culture doesn't mean that Candida albicans is pathogenic, as it may be commensal. As in this we have discussed in first slide that these are basically commensal organism, but if their growth occurs in extra, then they may cause diseases. Next come identification, how we can identify the culture. The different species of Candida can be identified by the following tests. For example, chlamydospore formation or cornmeal agar. The other name is Dalmio plate. In this formation, we use rice starch agar media, and when the colonies appears like this one, chlamydospore formation we can see. Next comes germ test tube. The other name is Reynolds Broad phenomena, and this we use sheep or human serum. In this culture, the colonies appears like germ tube, like formation of a germ tube from the chlamydospore. Next is carbohydrate assimilation. Fourth one is oxanography, and fifth one is latex agglutination. Oxanography we use here as in oxanography we study the effects of changes in the environment on the growth of microbes by means of oxanogram. Treatment of candidiasis varies depending on the area infected. For example, thrush is related to oral one. The doctor treats thrush with topical antifungal medications such as nystatin, mycostatin, and others, clotrimazole. For mild cases, a liquid version is used for nystatin and can be used in the mouth and swallowed, or a clotrimazole lozenge can be dissolved in the mouth. For more severe cases, fluconazole, diflucan can be taken once a day by mouth. Esophagitis, Candida esophagitis is treated with an oral antifungal drug such as fluconazole. Cutaneous candidiasis. This skin infection can be effectively treated with a variety of antifungal powders and creams, basically because these are skin infection. So we can use powders and creams. The affected area must be kept clean and dry and protected from chapping. Deep candidiasis. It usually starts with an intravenous antifungal drug because this candidiasis is in the bloodstream, such as voriconazole or fluconazole. People with very low white blood cell counts may need an alternative intravenous antifungal drug such as caspofungin and micafungin. These are samples like oral syrup candidate. This is a amphotericin antibiotic. This is a topical ointment for multipurpose use. For cutaneous candidiasis we can use. Next one, vaginal yeast infection. It can be treated with antifungal medications which can be applied directly on the vagina as tablets, creams, ointments, or suppositories. These include butoconazole, clotrimazole, miconazole, nystatin, ticonazole. Single dose of oral fluconazole can be used. Prevention. How to prevent from candidiasis, as candida grow in moisturous place. So keep the area cool, dry and clean. Dry off after shower or swimming. Change out of wet clothes by using antibiotics only as your doctor directs. For following a healthy lifestyle, use include proper nutrition. People with diabetes should try to control their blood sugar level, and if there is a HIV patient or any other recurrent episodes of thrush, then antifungal drugs such as clotrimazole, lotrimin, micellar can help to minimize flares ups. Prognosis. Healthy people with superficial candidiasis are properly treated. Infection goes away without leaving permanent damage. Superficial candidiasis may return if a prolonged course of antibiotics is needed or there is a change in your overall health. In people with chronic illnesses or weakened immune system, episodes of candidiasis may be more resistant to treatment and may return after treatment ends. In people with deep candidiasis, which are diagnosed with quickly and treated effectively, have the best prognosis, especially if the infection can be stopped before it spreads to major organs.